I want to talk more about the Women's Health Initiative study because a lot of doctors that are telling you hormone therapy for menopause, especially estrogen therapy for menopause is bad for you, are doctors who all they know is what the study said. And the Women's Health Initiative study is one of the biggest study in the history of women's health. And unfortunately, one of the limitations of this study is that it shows what was available at that time, which is oral estrogen. We don't use oral estrogen anymore. It shows a form of oral estrogen called Premarin, pregnant mare urine Premarin, which contained 50% or more of estrone, which is supposed to be a deposit, very weak form of estrogen, but it also might have carcinogenic, cancer-inducing properties. 40% or so were equine estrogens, and less than 5% was estradiol, actually estradiol. We don't have this oral compound around anymore. I mean, it's still around, but very few physicians probably practice and prescribe it. So that's a little bit like, let's take it, put it on a shelf somewhere. We don't really practice with that kind of medication anymore. So it's true that that study was great in the sense that it was one of the biggest studies in the history of women's health research, but it used the wrong hormone. Another problem is that we have now transdermal estrogen in the form of a patch, an estradiol gel. They're both FDA approved. We have estradiol topical compounded prescriptions that are bioidentical. We have estradiol pellets. We have many options of giving estradiol to women. Actual pure bioidentical estradiol, which is very different than the very minimally containing estradiol of that oral pill. So when you look at research from a point of view of what is safest, well, technically you'd have to do the same amount of research that was involved in the WHI study. If you think about it, you want to take 5 years, you want to follow 10,000 women, give them patches to all of them. Now, here's the thing, Premarin was easy. What, only one dose? Well, this is not easy. The patch is 5 doses. And some women do better on one dose, some women do better on another dose. So how are you going to look at all of that? Are you going to do 10,000 women in every single dose? That's really, can't even start to think about the possibility of what would that entail, and the cost, and the labor, and the data analysis, and all the people that would have to be involved. Well, that's just one thing, the patch. What if we want to study the estradiol gel as well? What if we want to study a bioidentical compound formulation? Well, guess what? Those are expensive. Nobody's going to pay for them. So studying bioidentical compounded formulations and going head to head with FDA approved drugs